Good morning. So this is the PPT. I am just very briefly explaining, then you can elaborate. I'll just tell you the PPT where what is. I'm not detailing because you know already the things. You can after seeing that PPT, if there is any doubt, you can ask specifically. I will elaborate that, or you can change also. I made the PPT as per my understanding. So it's this is all about delirium, which is an acute organic brain disorder. Okay, so it's a serious disturbance in mental abilities that results in confused thinking and reduced awareness of environment. So these are the how to diagnose. These are the criteria. There are 5 criteria elaborated here. A disturbance in attention, that is reduced ability to direct, focus, sustain. There is a shift of attention and reduced orientation to the environment. So these are the 4, like that 4 diagnostic criteria are elaborated here. So this is an how to evaluate, or you can tell the severity of delirium. So first you evaluate the mental status. If it may be normal, or there is a brain dysfunction. So this may be a subsyndromal delirium, or it's a delirium or coma. Okay, so this is a sedation scale, the Richmond agitation and sedation scale. So these numberings are used, which is from +4 to -5. Okay, this will be used to evaluate the severity of delirium. So what are the clinical phenotypes? There is a hypoxic delirium. That means hypoxia means lack of oxygen in the body, which in turn start to damage the brain cells. There is a septic delirium due to infection. There is a sedative associated delirium, which is caused by the use of sedatives. So if there is a metabolic disorder, it may cause the delirium. Or some deliriums, the reason of some deliriums are unknown. That means it is in absence of hypoxia, this septic sedation, and the metabolic dysfunction. This is not due to that, some other reason which is not known, that is treated as unclassified. So this is a graphical representation. This is the graphical representation in percentage. So in case of, you see in the first figure, the hypoxic delirium is in the plot, the x-axis is steady day and y-axis is the percentage. The percentage of delirium subtypes. So you see here, in the first figure, the hypoxic delirium is dominated, and in different color it was represented. So from various clinical studies with detailed data, it was grossly observed that the hypoxic, septic, sedative associated, metabolic and unclassified deliriums in percentage wise are 71%, 56%, 51%, 64%, 25% and 22% respectively. So these are the clinical study. One study was done. I got it from internet. So this is the percentage wise it is elaborated. What are the causes? You know that due to it may cause due to head trauma, high fever, toxic metabolic poisoning, epilepsy. Then if there is your aperture of the artery and veins are narrow, then it may cause indirectly the hypoxia or ischemia. Okay, and if there is a brain hemorrhage, pneumonia, meningitis, anemia, cardiac failure. Okay, means you know this the HIE, the hypoxic ischemic encephalopathy, which is happening for the mainly child during the prolonged labor. This also may cause the delirium to the children. See, this is a confusion assessment method, CAM, how to monitor the delirium. It is tabulated, various questionnaires. Using that you can assess the severity of delirium. Okay, so these are the question, and based on the response from the patient you can denote it by 0 and 1, and if the final after assessment, after adding all the points based on your scale, sedation scale, if it is the final numbering, if it is 0, then there is no delirium. If it is 1 to 3, then it is subsyndromal delirium, and it is 4 to 8, that means it is delirium. These are the risk factors. These are the risk factors are elaborated here. Okay, so here some suffix are I took from a book. So here the suffix are denoted A and B. So A indicates the non-systemic review, and B represent the systematic review. Okay, so it was observed that the mortality is twice more likely to die for a patient with delirium. Okay, and the length of hospital stay will be 2 days longer compared to normal patient and the delirium patient, and ICU length of stay also 1 day longer in case of the delirium patient. Okay, then the discharge, after discharge also there is a dysfunction of cognitive and excessive function. It was observed because from some patient the study was done. It was observed that a patient who discharged from delirium from a hospital, and there is a severe cognitive and executive dysfunction, it was observed after 3 and 12 months also. Okay, 85% of the delirious patients experienced a decline in activity of daily lives. Okay, it was also observed that the patients who already suffered in delirium, they having severe post-traumatic stress disorder, PTSD. So this is a intersection. This is an intersection of mental disorder and delirium. Okay. So you see, this is the yellow is the delirium, and this portion is the delirium, PTSD, and major depressive disorder. And this here it is a comparative study, and the intersection is plotted, which is delirium versus mental disorder. You can elaborate. There are several prediction rules are there. So here I have represented one particular prediction rule where the risk of delirium is calculated using this formula, which is 1 by 1 plus exponential e to the power minus 4.0369 plus 0.02 into age plus 0.03 into this. This is also Apache 2 is also a sedation scale. So based on that, these are the after several regression interpolation, this formula was achieved. So for children, how to predict the delirium? This is a pediatric delirium assessment. So these are the questionnaires, and here 4 is never, 3 is after you after evaluating the question, you can score it numerically by 4 to 0. So you can put it like that, and if after adding all, if the score is greater than 9, then the child is in delirium. So these are the children's risk factors. If there is a developmental delay, blood transfusion, mechanical ventilation, use of physical restraint, these are the pictorially it is explained. Okay. And the possibility of delirium, in case of delirium, it is for children also. It increased the length of stay in the hospital. It also increased the duration of mechanical ventilation, and the mortality also. In case of delirium children, it is 4.39 times increased. There is a increased risk of mortality. This is the prevention and management in case of children. So the family people should be closely attached with the children. You need a child psychiatry consultation. Okay. You have to make the home comfortable. There should be less light during the night. All these things here, it is very simply, it is pictorially explained. You can elaborate. So this is a figure which elaborated the various kind of primary injury and the percentage of delirium occurred or caused due to primary neurological injury. Here, because I am doing some clinical research work on evok potential and EEG. You know, this is the encephalogram, is the electrical response from human scalp. So this part you can elaborate, and I will also tell you in future what are the scope of work you can extend. So this is a normal ECG of a 45 years old male. Here you see in the EEG you can clearly it is visualize the eye blink articles. So it's a normal EEG. But here you see this is a EEG of a patient who is suffering in delirium. So you see here is no anterior and posterior gradient. So, and there is no background differentiation here. So this is an abnormal EEG, and this is due to delirium. This is another abnormal EEG, and this is also case of delirium. You see here is the high. You see these are the high amplitude polymorphous delta activities. So this is also a EEG of a patient who is suffering in delirium. You can elaborate this. Another part I have not elaborated, that if you need I will add it. There was a close association of inflammatory biomarkers like blood counts, CRP, that C-reactive proteins, ESR. It significantly changed in case of delirium, and there is a significant perturbation in neurotransmitter fluid also, because you know neurotransmitter fluid, when the electrical signal passes from neuron to neuron due to some event, so the electrical signal from one neuron to another neuron, and it excites the particular area of our hypothalamus. So this neurotransmitter fluid, basically it's control the impedance while the electrical signal is getting transmitted from one neuron to another. So there is a significant perturbation in neurofluid transmitter in delirium. So this is a vast part. I have worked a lot on that, so that I have not elaborated. If you need, I will add it later. So what are the treatment? So you identify the reason. You identify the reason of delirium and that particular attack on that particular reason. Apply some antipsychotic drug, anti-anxiety drug. IV fluid is must, because when the patient is severe, he will not take food. The body is needed to be hydrated. So for that IV fluid is to be applied. Definitely you should give vitamin B1, because it is very much necessary for the growth and normal activity of brain memory cells. The future work here, actually so far you will get several studies on EEG, because you know EEG is a very costly affair. and it is well popular. But if you can extend this study for evoked potential, means if the data set can be could be collected for somatosensory, visual and auditory evoked potential, then for the delirium patient, then we can extend this study further, that how from the evoked potential, how the severity and the nature of delirium could be assessed. So this could be your future work, because already I am working on evoked potential with my professor from his master degree from JIPMAR, and he is from Stanley Medical College. So already I am working for that. So if you want, if the data set can be collected, then we can extend this study for delirium also, and mainly it can be in case of HIE. In case of HIE, the evoked potential is a very good measure to assess that. So the same thing we can extend in case of delirium also. So this is very briefly I elaborated the slides. I have not explained in details, so this I am giving to you. You can modify, or any place if you want to, if you can't understand, you can ask me further. I will be happy to explain in details. Thank you so much.